Hey, Mrs. Smith, I'm Rivers. I'm going to be taking care of you today. We have a doctor's order to put in a urinary catheter just to relieve some of that pressure and make you able to urinate. Can you confirm your name and date of birth for me? All right, and do you have any allergies? Okay, so I'm going to wash my hands. Actually, I'm going to explain the procedure. So today we're going to be doing the urinary catheter. Just since you're unable to urinate, this will help to relieve some of the pressure you're feeling and just relieve the pressure. So we are going to ensure that you have privacy since we will be exposing areas to insert the catheter. Okay, I'm going to wash my hands and put on gloves. Okay, so we're going to place the patient in the dorsal recumbent position. Alright, and so we're going to clean the perineal area. So we'll go once on the side, the other side, and then down the middle. All right, and we're going to discard that. All right, and so we're going to begin the sterile procedure for the urinary catheter. So I'm going to put the alcohol-based hand rubs on my hands and then begin with the procedure. Alright, so I'm going to put on sterile gloves. Alright, so we're going to move this over to the bed. I'm going to apply lube to the end of the catheter, 1 to 2 inches. And then connect the syringe. And test the balloon. All right. And it works. So now I'm going to empty the betadine, put it in the tray, and then clean the perineal area one more time using sterile procedure. So one time and then discard on the side and then discard and down the middle. All right, so I'm going to insert the catheter. I'm going to insert it until I feel pressure and when the urine starts to come out, and then when the urine starts to come out, then we'll insert it at least 1 to 2 inches more. Okay, so then we're going to blow up the balloon once the urine comes out. All right, and disconnect the syringe. So we are going to secure the catheter, putting it on the leg and bringing the bag down under the bed so that the urine can drain down. And we will collect urine from the bag within the first 5 minutes, but then after that, we must collect it from the port because after 5 minutes, the bag can start to gain bacteria buildup. So we are going to collect urine from the port. All right. And we collected 40 milliliters of urine. So with this, I will just secure the bag. I will make sure that the patient is feeling comfortable and okay, clean the area, and if I were to leave the room for a long period of time, I would fix the patient in a comfortable position, lower the bed with all rails up, cover the patient up, but for video purposes, I'm going to leave it like this. Okay, so we're back to remove your catheter, Ms. Smith. Can you confirm your name and date of birth? Okay, and so the doctor has our order to remove the catheter now. And so now we would get the syringe connected and let the water drain out. All right, so now we're going to be removing the catheter. Perfect. So now we remove the catheter and we're going to empty the bag before this and discard. You feel better, Miss Smith? All right, perfect. So we're going to gather up the supplies. And then we're going to clean the perinatal area and make sure it's clean and dry. Discard. All right, Miss Smith, I hope that helped and worked to relieve some of the pressure you were feeling.